Welcome to Ask the Expert on WMTR 1250 AM, a Beasley Media Group station, streaming live on WMTRAM.com and TalkStreamLive.com. I'm Jessie Frees. Julie Briggs and I host the award-winning Your New Jersey Connection and Ask the Expert, the longest-running ahead of the curve talk shows on the station and in the state. According to USA Today's front page news, this week the Delta variant continues to spread in New Jersey and is likely to become the most common COVID strain, almost tripling in occurrences over the last 2 weeks. The highly contagious variant accounted for over 26% of all coronavirus strains. It has become the most dominant variant in the United States. Although it is still number 2 in New Jersey, it is quickly catching up to the B.1.1.7 alpha variant, which exploded over the winter in New Jersey and currently makes up 40% of all strains. Joining me this morning on Ask the Expert is Dr. Edward McManus, MD, FACP, an infectious disease specialist affiliated with St. Clair's in Denville and Dover, Morristown Medical Center, Newton Medical Center, Hackettstown Regional Medical Center, and Chilton Medical Center. Dr. McManus's offices are in Randolph, New Jersey. He's a graduate of Johns Hopkins University and UMDNJ New Jersey Medical School. He was formerly chief resident, University of Wisconsin Hospitals and Clinics, with a fellowship at the National Institute of Allergy and Infectious Diseases. Dr. McManus became interested in infectious diseases 40 years ago while working with HIV patients and the drugs used to treat them. Dr. McManus has served on numerous committees and boards at local hospitals and has received many, many awards for his outstanding work. It's a pleasure to have you join us this morning, Dr. Edward McManus.
Thanks very much for that introduction.
Well, you're certainly welcome, and it's a pleasure to have you on today. We celebrated Independence Day, Doctor, from COVID-19 on the 4th of July, and it felt good. Yet less than 1/2 of the country is fully vaccinated against coronavirus and the highly contagious Delta variant, which is now spreading in New Jersey. Outbreaks are rapidly occurring. How risky is this?
Well, I think that we're very lucky in New Jersey. I think we're ahead of the national curve in vaccinating people. And I think we've done a great job at providing vaccines for people who are most vulnerable, the elderly, the people living in nursing homes, people in institutions are very well protected. But right now, what we're waiting for is the next surge, which is going to occur in the people who are not vaccinated. And we're very worried about it. The Delta variant is much more contagious and possibly more severe. And sadly, we still see patients being admitted to the hospital with COVID. And they're invariably people who did not think they were at risk and were not vaccinated. We recently had a young 39-year-old woman who was obese, came into the hospital with COVID and died. And she certainly had the opportunity to get vaccinated, and she didn't think she was at risk. So it's still very dangerous out there. In New Jersey, we're just over 5 million people vaccinated, but that still means that we have about 3.5 million people, 4 million people not vaccinated, and that's a group that is going to be at risk. Fortunately, it's a summer, and we're not spending a lot of time indoors, which is where a lot of transmission occurs. But it's just a moment that is yet to happen. We're hopeful for herd immunity, but herd immunity isn't like a goal line where you get across the goal line and you're done your work. In New Jersey, we're in the mid-60s in the percent of adults who have been immunized. And it still looks like at our current rate, which is about 17,000 people a day are getting vaccinated, it's still going to take us several months to get over 75%.
Uh-oh.
Dr. Fauci, with NIH, has said that he thinks we need to get somewhere between 70 and 85% in immunity to protect the community at large. And so that's sort of where the plan of attack is. herd immunity is sort of shades of gray. The more immunity we develop, the safer we'll all be.
That's very true. But does the current vaccine, will that protect us from this new Delta variant?
Yeah, the current vaccines are very effective against the Delta variant. The CDC just this week came out with some data showing that in real life, in the millions of people vaccinated in the United States, the efficacy is about 91%. So it's really maintained that promise that we had of over 90% when the vaccines were first introduced.
Well, that's good. And public health experts fear that across the country, celebrations are sending wrong safety messages with groups of the population remaining vulnerable. Do you see a rise in infections from the 4th of July?
Well, I think that for the most part, the incubation period for the virus is between 2 and 14 days. So we have seen a slight blip in the last few days in admissions to the hospital. I was just looking at some data at the Hackensack Meridian system where
Right.
they've seen a bump up in cases. And we're basing off a small number. Right today, there are about 300 people in the hospital in New Jersey, and we're diagnosing about 200 to 300 new cases each day. There was a day earlier this week where we had no deaths.
That's
Yesterday
good
there were 8 deaths.
news.
And that's the first time we've had no deaths in months.
Yes,
So it's
that's
definitely
wonderful.
down, but unfortunately we have people ready to have a victory dance
Yes.
and party, and we all want to feel free and safe, but we're most safe if we're all vaccinated.
That's right. As some experts said, we shouldn't unfurl the flag of congratulations as mission accomplished until it really is. I've got about a minute left before this break, but 14 southern states are extremely vulnerable and have low vaccination rates. Are they risking the rest of us?
Well, it's really about face-to-face contact and being in close proximity to other people, and so really that's about travel to those areas. But if you've been vaccinated, you're protected from severe illness and death. But people who are vaccinated, a very, very small number, may still get the virus, but have a much milder illness and be safer.
Oh, so much more I want to
travel
ask
anywhere
you
you want.
on all of
Sure.
this about people that have taken it and people that can't take it. My guest is Dr. Edward McManus, MD, FACP, infectious disease specialist affiliated with Morristown Medical Center, St. Clair's in Denville and Dover, with offices in Randolph, New Jersey, and elsewhere. He's a graduate of Johns Hopkins University, UMDNJ, New Jersey Medical School, and he's discussing COVID-19 and the Delta variant. I'm Jessie Frees. We'll be right back with Dr. Edward McManus. Welcome back. My guest today is Dr. Edward McManus, MD, infectious disease specialist, and he's updating us on what to do in case of the virus and how to best handle it. There's so many questions I want to ask you. If the Delta variant continues to circulate, could it mutate in a way that leaves even the vaccinated vulnerable? And what can we expect this fall? Will we have to close everything up again if it does come back?
Well, the virus has a plan of its own. We don't have a lot of control over it. The way viruses survive is they do mutate. So the more transmission, the more spread we have of the virus, the increased risk of new variants occurring. There's another variant called the Lambda variant that was first identified in South America. And that's, an issue in other parts of the world. All these viruses compete with each other, and there's always the opportunity for a new virus to come along. So a lot of that's unpredictable, and that's really why it's been so difficult and why we've all felt the strain of different recommendations that have changed over the past 18 months, because the virus doesn't do exactly what we predict.
No. Certainly doesn't. And should vaccinated people still continue to wear face masks to stop the spread of the COVID-19 and Delta variants? And can we rely on the honor system, or should we?
Well, I think we have to rely on the honor system. It's the only way we can survive, and that's sort of probably part of the American system, is to have some trust in other people. But I think getting back to the reason to wear a mask is that the reason why you should wear a mask as a person who's vaccinated is to protect your friends and people who haven't been vaccinated. Mask wearing is primarily now to protect people who have not taken the vaccine.
What happens to the person that due to conditions cannot take the shot?
Well, I think those people have to be more careful. They have to be more careful about being in crowds, coming in contact with other people. And I think they have to ask other people who are in their company that to ask them to wear a mask to protect them.
And what if you've taken one shot and not a second shot? How protected are you?
Well, with vaccinations, it takes at least 2 weeks to have any benefit from them. So once you've had the first shot, you have some protection in about 2 weeks. And the initial data shows that that's about 80%. We have less information about the Delta variant, and we are concerned that the Delta variant protection is best manifested after the second shot.
And as the country reopens, some people remain vulnerable. It's reported that the vaccine is less effective for those who have received an organ transplant. That was in today's paper. Is this true?
Well, the vaccine is dependent on your immune system being healthy. So if you have any impairment in the immune system, which would include being on immunosuppressive medications, being on steroids, getting chemotherapy, having an organ transplant, you're going to have less effect, and that occurs with any vaccine you get. But there is still some benefit, no matter how weak that immune system is. We're going to get some benefit, we hope, from vaccinating everyone.
Yeah, and we hear, Dr. McManus, that the Delta virus was detected in India in December and is now in 80 countries. Is this moving faster than COVID-19?
Well, we know that the Delta variant is about 40% more contagious, and it really just demonstrates, we live in a global world, and so what happens elsewhere is, really in our own neighborhood.
But what is your take on, or do you approve of vaccines for children under 12, and how can they be protected when they go to school?
Well, right now, the vaccines are approved down to age 12. Under age 12 is still undergoing studies to demonstrate safety and also demonstrate efficacy. We know that children are not as severely ill, but there's a lot of things that people make a lot of comments to us about what they think are the risks of the vaccine. What doesn't get discussed is what the risk is of having the virus.
Right.
And we see patients now who they weren't even hospitalized, but they're still sick months after having the virus. And I don't know yet, and none of us do, what chronic illnesses may develop because you had COVID. There's very high likelihood that you're going to have some underlying lung disease long term, even if you survive COVID and don't get very sick from it. And that's a lot to be worried about. And we also don't know what the long-term manifestations of the virus for our children. Obviously, we're not seeing deaths in children, but we don't know whether this might be a precursor to developing some chronic lung disease, a precursor for developing asthma in the future. Those are all the unknowns.
Well, I only have 2 minutes before this next break, but there have been reports of a likely association between two coronavirus vaccines and increased risk of a rare heart condition in adolescents and young adults. What is your opinion on that?
Well, there actually is some data that's come out about that. For that, it's a myocarditis, it's an inflammation of the lung, it's an immune inflammation. And in young men ages 20 to 29, the risk is 40 per million doses of vaccine. So it's definitely something that can happen, but it's still far, far less serious and dangerous than the virus itself. That's the highest rate in young men over the age of 30 to 39. The risk is about 2 to 3 per per million treatments. And in women, it's lower than that. So it's definitely a complication we've seen, but it's a small risk compared to the risk of the virus itself and its complications.
Well, we have to go on a quick break, but when we get back, we have many more questions to ask you. And one is, what about the states? Are they opening up too fast? When Dr. Fauci said the Delta virus could most likely be dominant this fall, should we rely on this? What is your take on that? I just have a minute left before this next break.
Well, the short answer is that it is time for us to see if we're going to be able to live with the virus. We've done a great job of vaccinating an initial group of people. There's still a large group that are hesitant, but they're coming around to believe that it's safe and that it's a benefit to them, their family, and the people they know, their friends.
Very good advice. We're talking to Dr. Edward McManus, MD, an infectious disease specialist, and he's warning us on COVID-19 and Delta variant and what to do and how to cope with this. We'll be right back with Dr. Edward McManus. Welcome back. My guest this morning on Ask the Expert is an expert on all of this, Dr. Edward McManus, MD, infectious disease specialist with Morristown Medical Center, St. Clair's in Denville and Dover, with offices in Randolph, New Jersey, and he's also in hospitals, other places in the state of New Jersey. Doctor, the Olympics in Japan are taking place within but less than a month. And they were allowing 10,000 local people in the stands for cheering, but they've called that off now. Is this dangerous, though, for the participants of the Olympics? Is this a super spreader event, would you say?
Well, I don't think it's a danger for the participants. It's really a danger for the spectators. When we look at athletic teams and we look at spread on athletic teams, the spread does not occur during the competition. The spread occurs when people are socializing, eating, and spending time together outside the locker room, in the dormitories, in those facilities where they're close and being social. But actually, we've had very little spread on the field of competition in most sports. So it's really about spectators. And that's really why they've made the move they have in terms of eliminating the spectators today, because of the increased risk of spread. You can imagine that you talk about 6 feet of spread as being the safe distance, but that's with just normal, quiet conversation. That risk of spread and that distance changes when people are yelling, shouting, whistling, singing. You need to be much further away from somebody who is being that active with breathing and their respiratory tract. And so that's the real risk in terms of going to a competitive event.
And what about opening up all the bars and the restaurants and places of the theaters and concerts? How safe is that right now with this Delta variant threatening New Jersey?
Well, I think all those places have an element of risk. It weighs a lot on the honesty and safety of people who are vaccinated being truthful and honest, and the people who are not vaccinated being more careful. But again, when you come to a situation where alcohol is involved, you usually have less safe behavior, and you're less likely to be consistent with wearing a mask if you haven't been vaccinated or keeping yourself socially distant. I mean, the point of going to these facilities is to socialize. So that's part of the challenge. It's against human nature to have people remain so separated and apart.
Right. And what about the opening of sending the camps, children at camps, overnight camps? What is your feeling on that? And children in general going to parties and probably taking a few drinks, are they vulnerable?
Well, I think it again becomes, good practice to, ask questions about what the guidelines and principles are for the children too. What's the policies for the staff to be vaccinated? What's the policies for the attendees to be vaccinated or to be tested? And it's very common. I know as we were raising our kids, if they were going to be spending time somewhere, we would be calling those parents and finding out what the details of the situation are. How people are going to spend the night, how much space there is, and there's lots of other things that are a risk in those settings beyond the COVID virus.
And how do you deal with people who say that COVID is a hoax, it's not really real? And what do you say to them, Dr. McManus? What you've seen happening in the hospitals?
Yeah, I think that anybody who's had a close family member or friend be sick and die from COVID has a different feeling about it. It's very hard to make an argument with them because usually that's not a rational thought process in terms of why they think that they're not vulnerable. This virus, doesn't follow any rules. It makes its own rules, and it's not a game you want to play when you don't know what the rules are.
Well, we certainly, it's kind of frightening for everyone. Is there anything we can do to protect ourselves from this besides just staying indoors?
Well, I think right now outdoors is actually safe. Outdoor activities, and keeping social distance. Being vaccinated is really the critical factor. I think that in the next few months, you're going to see more and more organizations and more systems require people involved to be vaccinated, to be part of those programs. Every day, a new hospital system that makes the decision to vaccinate all their employees or require that. We already have that as a rule in New Jersey at most facilities that people have to be vaccinated for the flu. And I think this is going to just be another part of, if you're going to care for people who are sick, we need to protect them, and to be in that career path, you need to be vaccinated to protect those people.
Well, thank you for this excellent advice. Unfortunately, our time has come to an end, and we thank you, Dr. Edward McManus, infectious disease specialist, for a most informative show. How can someone get in touch with you?
Well, we have a large presence in the state, and we have a number of offices. You can find us on the internet on idcare.com.
Okay.
And our office number locally in Randolph is 973-989-0068.
Well, thank you so much for joining us, and I certainly look forward to more updates with you.
Thanks very much for inviting me to participate.
Well, thank you. And coming up, Person of the Week, brought to you by Crawford and Lorenzo Home Selling Team, a Keller Williams Realty in Morristown, New Jersey, followed by Julie Briggs and her riveting political roundtable. Don't miss it. I'm Jessie Frees. Have a good day. Good day.